Why don't you say hello? And we see what book you've got there. Oh, I know all about POTS. Why don't we help inform the audience? You see, postural orthostatic tachycardia syndrome, POTS, is a disorder of the autonomic nervous system. Now, I know that seems like a lot at once, so let me try simplifying it. POTS disorder is characterized by oh, there, be careful. Why don't you sit back down? As I was saying, POTS is characterized by an abnormal heart rate increase upon standing, as you just experienced. Now let's take a look at why. When a person stands up, gravity causes 10 to 15% of your blood to settle in your abdomen, legs, and arms to compensate for the lower amount of blood returning to your heart and brain after standing up. Typically, the autonomic nervous system turns on a series of rapid responses. Those responses include releasing two hormones into your body. Epinephrine, also known as adrenaline, causes your heart to beat faster. Norepinephrine causes your blood vessels to tighten and constrict. Both hormones work together to return more blood back to your heart and brain. However, for an individual with POTS, their autonomic nervous system struggles to communicate effectively, making it so the blood vessels do not constrict when needed, but the heart still beats faster from the adrenaline. This imbalance causes many symptoms such as dizziness, exhaustion, rapid blood pressure changes, and even fainting. While that's the diagnostic criteria for POTS patients, the imbalance and lack of communication with the nervous system causes for a vast range of symptoms. These symptoms include, but are not limited to, headaches, migraines, shakiness, heart palpitations, chest pain, racing heart, GI problems, cognitive impairment, poor circulation, exercise intolerance, nausea, diminished concentration, coldness and pain in extremities, and a temperature regulation imbalance. And you don't need to have just stood up to experience these symptoms. They can appear at almost any time. Certain things tend to make symptoms worse, such as standing, heat, exercise, and any sort of illness, even one as simple as the common cold. Symptoms vary and range from person to person. Some have very mild symptoms and can continue mostly with their day-to-day lives. However, for some, symptoms may be so severe that normal life activities such as bathing, housework, eating, sitting upright, walking, or standing can be significantly limited. 25% of people with POTS are unable to work or even attend school. For perspective, physicians with expertise in treating POTS have compared the functional impairment in POTS patients to the impairment seen in congestive heart failure. Researchers found that the quality of life in POTS patients is comparable to patients on dialysis for kidney failure, and no cure has been found. Let's check back in on Colleen to see how she's doing. There she is. Seems like she's still processing some of the information. Maybe she'll still be able to answer a few questions. Colleen, how many years did it take from the onset of your symptoms to getting diagnosed? Wow, 5 whole years. And how many doctors did you see during that time period? 34 doctors. Isn't that just sad? You see, POTS patients typically endure an average 4-year diagnostic delay due in large part to lack of awareness. A prolonged search for a diagnosis can cause tremendous financial strain for patients and their family, in addition to years of suffering without a diagnosis or proper treatment. While there is no existing cure, it is possible to see an improvement over time with proper lifestyle adjustments with exercise, diet, and medical treatments, and can lead to an improvement in quality of life. It's important to make these changes when able because while the prognosis is good for most patients, researchers have noted that some patients may not improve and can possibly worsen over time. That is why awareness is so important, to serve as a reminder that just because someone's disability isn't visible doesn't mean it's not there. And also to help people like Colleen here to find a diagnosis faster and to not have to suffer through years of confusion, pain, and countless doctor's appointments.